everyone, this is Nicole Freeland, and today we are discussing Chapter 39, Care of Men with Reproductive Disorders. Your objectives for this chapter, the student should be able to review the effects of aging on the male reproductive system. The student should be able to summarize the medical and nursing management of erectile dysfunction, recognize factors involved in fertility, infertility, and contraception in men, present the most common diagnostic tests and examinations of the male reproductive system, explain the assessment of the male reproductive system, outline the pathophysiology and manifestations of common disorders of the male reproductive tract, compare and contrast 4 types of surgical treatments for BPH, discuss inflammations of the male reproductive system and their treatments, and illustrate the patient teaching involved for early detection of testicular and prostate tumors. The male reproductive system is shared with that of the urinary tract. Androgens are male sex hormones. The production of sperm is known as spermatogenesis. The hypothalamus, pituitary, and testes are all organs that are responsible and influence sexual function. Penile erection and ejaculation of semen is necessary for fertility. The parasympathetic and the sympathetic nervous system influence normal sexual response. Some common age-related changes within the male reproductive system. The scrotum, as the male ages, becomes more pendulous. The prostate may enlarge, resulting in urethral obstruction. Testosterone and progesterone levels are decreasing with the age of the male. Sperm production and ejaculation volume decrease. However, fertility should remain intact. After the age of 60, it's common for arousal to take longer for a male, and the firmness of the erection may actually decrease. Then there are some vascular problems that individuals experience as they age, such as hypertension. These can be the main cause of impotence in the older adult male. Okay, so we'll talk a little bit about methods of contraception. It is important to note that contraceptive methods are not only the responsibility of the female, but the male as well. These are methods that are used in preventing unwanted pregnancies. There are reversible and permanent options. The reversible methods are spermicidal creams, gels, and foams. These are more effective when used with a condom. It's important to note that water-soluble lubricants should be used with condoms to prevent the breakdown or breaking of a condom. Condoms do provide some protection against STIs and STDs, but they are not 100% effective. And then there is the permanent contraceptive method. This is a vasectomy. This is where the vas deferens are either burned or clipped to obstruct the flow of sperm upon ejaculation. This might at times be able to be reversed, and that is actually a microsurgery that is performed because of the very tiny, small tubules that you're dealing with, those vas deferens. This procedure is called a vasovasotomy. When we perform an assessment on a male for the reproductive tract, the age of the individual is important to note. After the age of 50, it is much more common for males to experience some enlargement of their prostate gland, and so we would focus the assessment on assessing for an enlarged prostate after the age of 50. It is somewhat awkward sometimes for some individuals to talk about their sexuality. So oftentimes it is easier to ask about questions regarding their urinary tract function first, just to ease tension with the conversation, and then work your way into asking about their sexual health as well. You may ask open-ended questions where you state, tell me about, or when did you first notice, to help the patient elaborate on the information that they are going to give you. We also will ask if they have noticed any changes or patterns in patterns of urination. Is there any difference in the stream of their urination? Do they have any discharge coming from the tip of their penis? Have they felt any masses or bumps on the scrotal area or in the groin area? Does the individual have any tenderness or pain to the scrotum or the penis? Do they have any rectal or perineal pain? Do they, in fact, perform a regular testicular examination? If so, have they noted any differences? Have they had any past infections of the reproductive system? We also need to note what medications they take regularly and also if they use any recreational drugs. And do they have difficulty obtaining or maintaining an erection? Testicular self-examination is very important for the male. We oftentimes think about the monthly self-breast exam, but we don't oftentimes think about self-evaluations that males could do to help detect early signs of cancer. This is in fact important for all males to do. It should be done on a monthly basis. It's important to note that the testicles are not generally equal in size, nor do they hang at the exact same amount that's normal. They need to be reassured that that is normal. The easiest spot for an individual to do this evaluation would be in the shower. It provides a warm environment so that the examination is more easily done. And then the individual will roll the scrotum between their fingers, actually their pointer finger and usually their thumb, to feel the surface of the testicle and check for lumps, bumps, or any unusual features. It is important to also note that cancerous tumors are not generally painful. If they do detect any abnormalities, they do need to report that to their healthcare provider as soon as possible. Some diagnostic tests that will be performed on males to help evaluate their reproductive health. Initially will include standard testing such as a CBC, a UA, a chem profile, and a thyroid function. And then serum acid phosphatase is usually elevated in patients with prostate cancer, and alkaline phosphatase is elevated if malignancy of the prostate has metastasized to the bone. We can also draw tumor markers to determine the effectiveness of treatment after an individual has begun treatment for cancer. And then a prostate-specific antigen test detects levels of a glycoprotein produced by the prostate that is elevated in prostate cancer. Other diagnostic tests for the male reproductive system include a digital rectal examination. This is performed to evaluate the size and consistency of the prostate and to detect any abnormalities or nodules. Then we have the semen analysis. This is actually performed from a sample that's given by the patient, and this is analyzed for volume of sperm content and its motility. Then we have a prostate-specific antigen test. And as I discussed before, this test detects levels of glycoprotein produced by the prostate that is elevated in prostate cancer. Then we have a transrectal ultrasound. This is recommended when a PSA or a digital rectal examination is abnormal. It may also be used to guide needle biopsies of the prostate. A urography is a radiological examination that detects changes caused by ureter abnormalities and follows urine excretion pathways. Uroflowmetry measures the volume of urine expelled from the bladder per second. This detects outflow tract obstruction. The patient voids into a urine flowmeter, and privacy will be provided for these patients. Biopsy, of course, to assess the tissue itself to check for malignancy. A cystoscopy is a lighted instrument that is inserted through the urethra into the bladder. This is used to detect prostate hypertrophy and bladder tumors. It is a sterile procedure and is often done under anesthesia. And then we have urethral smears. These are laboratory studies used to identify pathogens. Often they are used to diagnose some forms of sexually transmitted infections. Some endocrine studies that are used. The first one is a luteinizing hormone. This is a hormone that is secreted by the pituitary gland. High levels may indicate testicular failure. And then we have prolactin. It is a hormone secreted by the pituitary as well, and it potentiates testosterone production. Follicle stimulating hormone levels may be drawn, or FSH levels. It's secreted by the anterior pituitary gland, and it stimulates the steroli cells in these seminiferous tubules to complete formation of mature sperm cells. And then we have the testosterone level. High levels may indicate a testicular tumor, and low levels may occur in older men. Because testosterone levels are highest in the morning and lowest in the evening, it is important to obtain a morning sample from your patient. Okay, now we will discuss some disorders of the reproductive system. The first disorder that we will discuss is erectile dysfunction, otherwise known as ED or impotence. Some common causes include hypertension, anything that would impede the blood supply to the genital area, impairment of hormonal supply, psychosocial impairments, sometimes anxiety and depression can cause this. Organic causes can also be a factor, such as diabetes mellitus and other endocrine disorders. Disorders of the urinary tract, neurological disorders, and chronic illness, such as sickle cell anemia, can also lead to ED. To diagnose ED, we would perform a complete history and physical. Sleep laboratory studies can be performed to monitor nighttime penile erections, to detect organic causes of impotence. A Doppler study can measure arterial flow in the penis, essential for erections. And nerve conduction tests can rule out neurological pathology related to ED. Treatment usually depends on the cause. The primary intervention for ED is modifying reversible causes of the problem. And then we can consider drug therapy after that. Some important considerations to remember are if the patient is prescribed Viagra, we need to make sure that they do not have a pertinent cardiac history, especially any patients that are taking nitroglycerin. This specific medication is in fact contraindicated with taking nitroglycerin. It can have some very serious side effects, So we need to make sure that we receive a thorough medication list from our patients. Um, Cialis is also another ED medication that some individuals may be prescribed. It's important to note that a common um, side effect from this medication would be a priapism. Um, this is the persistent abnormal erection that can develop into a urologic emergency at times. Ejaculation disorders are usually caused by spinal cord injuries, sometimes multiple sclerosis, diabetes mellitus, urological surgeries, and specific medications that the individual might be taking. These disorders include premature ejaculation, which is the most common disorder. And then there is retrograde ejaculation. This is where the semen actually travels towards the bladder instead of being expelled by the urethra. This usually occurs after a prostatectomy. Infertility is actually defined as the failure of a couple to achieve a pregnancy after at least 1 year of frequent unprotected intercourse. Approximately 25 to 30% of infertility may result from factors in the male partner. Hypothalamic pituitary disorders and ED contribute to infertility, but testicular disorders are the most common organic cause of male infertility. Drugs, infectious, systemic diseases, and congenital disorders can cause testicular failure. A semen analysis with sperm count and activity is performed. Laboratory tests performed include FSH, LH, and testosterone levels to determine whether hormone therapy is indicated. A post-ejaculation urine specimen may be examined to diagnose retrograde ejaculation of semen into the bladder. An ultrasound of the seminal vesicles may reveal dilated vesicles and obstruction of the vas deferens near the ejaculatory duct. Surgical resection of the ejaculatory duct may be indicated. A fine needle aspiration or a biopsy of the testicles may reveal pathology that can be treated. Discussion with both partners concerning technique and timing of intercourse is indicated. Pathology may be corrected with medications, hormone therapy, or surgery. In vitro fertilization or intracytoplasmic sperm injection after sperm extraction is often successful in treating male infertility. The environment should be evaluated for toxins such as pesticides, lead, mercury, or radiation exposure, all of which can affect fertility. Occupational influences on fertility include exposure to heavy metals, solvents, fumes, or polycyclic aromatic hydrocarbons. Patients seeking fertility should be instructed to prevent excess heat around the scrotal area, which could decrease sperm development. Hot tubs, using a laptop on the lap, and tight underwear should all be avoided. So we could educate our male patients over the use of boxers versus briefs. Stress reduction techniques, information concerning timing and technique of intercourse, optimum nutrition, and health practices should be reviewed with both partners. Hydrocele is a larger than normal amount of fluid accumulated in the space between the testes. Causes include infection and trauma. Signs and symptoms include a larger than normal amount of fluid around the testicles or the scrotum into the scrotum area. So you will have an enlargement of the scrotum itself. Treatment, when it is indicated, includes aspiration or surgical incision and drainage of the sac. A pressure dressing will be applied post-operatively, and oftentimes there will be a drain in place as well. And these individuals do need to wear an athletic supporter or a constrictive supportive device after surgery. Varicocele is the dilation and clumping of the tributary vessels of the spermatic vein, which causes painful swelling. Causes include retrograde blood flow from the left renal artery. Treatment includes injection of a sclerosing agent or ligation of the spermatic vein to improve infertility. Nursing interventions will include encouraging your patient to increase fluid intake. They may also run a fever, so fever reduction with Tylenol may be indicated, and then oftentimes these individuals just basically need to rest and recover, so we will promote resting for these individuals. Priapism is simply a prolonged penile erection. This can be caused by neurological factors, vascular issues, medications, or sickle cell disease. Signs and symptoms include, obviously, a large, hard, painful penis unrelated to sexual desire or activity. Voiding is often impaired as well. Treatment will include sometimes sedation, often bed rest, warm baths or enemas to help to dilate those vessels there so that blood flow will return to that area and hopefully decrease the erection. A urinary catheter may also need to be placed so that these individuals are able to void. Aspiration of the corpora cavernosa with a large bore needle is the last treatment of choice, but that will help to decrease the erection in an emergent situation. Nursing interventions will include providing emotional support for these individuals and, of course, pain management for them as well. Peyronie's disease. This is actually a disorder where plaque of non-elastic fibrous tissue developing in the tunica portion of the dorsal corpus cavernosa prevents the male from obtaining a full erection. Signs and symptoms include ununiform erection that curves upward. This is often treated with local injections to dissolve the plaque. If that treatment is ineffective, then surgical intervention may be indicated. And then we will talk about benign prostatic hyperplasia, or BPH. This is the enlargement of the prostate. Signs and symptoms include difficulty urinating, hesitancy, dribbling after voiding, frequency, nocturia, which is frequently voiding at night. Complete obstruction of urination may occur in the late stages. This is often diagnosed with a digital rectal exam followed by a urodynamic study, ultrasound, and then often we will get a creatinine level. Treatment includes catheterization, drug therapies, herbal therapies, and surgery may also be indicated. Some drug therapies that are available are alpha adrenergic blockers. These promote relaxation of smooth muscles and reduce blood pressure. 5-alpha reductase inhibitors are steroids that may take several months to work. Anti-endogenous agents such as finasteride or Proscar and dutasteride or Avodart can decrease prostate size by reducing DHT. PDE5 enzyme inhibitors are agents that inhibit the enzyme PDE5, thus producing an increased vasodilation and inducing smooth muscle relaxation. Herbal therapy may include therapies such as saw palmetto. These have been thought to relieve symptoms, although research has not proven their effectiveness, and the side effects may include an increase in blood pressure and gastrointestinal disturbances. Surgery may be necessary if other interventions have not been effective. The most effective way to reduce symptoms is actually through surgery. This includes transurethral resection of the prostate, known as a TURP or a TURP, transurethral incision of the prostate, laser photoselective vaporization of the prostate, and open prostatectomy. Serum PSA is a protein-specific antigen that is produced by the prostate tissue and is elevated with BPH. Cancer of the prostate and prostatitis and after prostate biopsies. So nursing management for these patients will include pre- and postoperative care. Preoperative care, urinary drainage is accomplished by insertion of a catheter using sterile technique. If the obstruction is severe, a urologist may insert a special rigid catheter known as a Coude catheter. A high fluid intake is encouraged and antibiotics are routinely prescribed. Preoperative teaching would include deep breathing exercises, range of motion, leg exercises, and general preoperative and postoperative routine education. Postoperative care will include principles of postoperative nursing that apply to all patients having major surgeries, such as pain management. Potential postoperative complications are bleeding, urinary incontinence, and bladder spasms. Because hemorrhage is a possible danger, vital signs are taken per agency protocol then every 4 hours after the discontinuation of the step-down unit. Epididymitis is inflammation of the epididymis. This can lead to infections. Some causes are infections such as chlamydia or other STIs. Signs and symptoms include groin pain, swelling, and pain in the scrotum. There may also be pyuria or pus in the urine, fevers, and chills. Treatment includes antibiotics, analgesics for pain, ice packs, sitz baths, and the elevation of the scrotum itself. Orchitis is the inflammation of the testicle. This may affect one or both of the testes. It may be caused by local or systemic infections, so viral or bacterial infections can be the cause, or by trauma. Bilateral orchitis is serious, and it often causes sterility. Mumps orchitis occurs in about 20% of adult men who contract mumps. Gamma globulin usually is given to decrease the possibility or severity of mumps orchitis, and the symptoms and treatments are otherwise parallel to that of epididymitis. Prostatitis is the inflammation of the prostate. It occurs from an infectious agent or other causes. There are 4 different types of prostatitis. The first type 1, is acute bacterial prostatitis with recovery of bacteria from fluid and signs of illness such as fever. Type 2 is chronic bacterial prostatitis. This is bacteria from fluid with no signs of systemic illness. Type 3 is non-bacterial prostatitis, chronic pelvic pain syndrome. With recovery of leukocytes, microscopic purulence of the prostate fluid, so pus within that fluid, is present, but few or no bacteria are recovered. And then type 4 is asymptomatic inflammatory prostatitis, or prostaglandina, with no bacteria or leukocytes in the prostate fluid, but there is persistent symptoms of prostate discomfort, including poor urinary flow, frequency, and dysuria. Signs and symptoms include recurrent urinary tract infections, pelvic pain, sexual dysfunction, and sometimes BPH. Because blood PSA levels are often elevated in prostatitis, misdiagnosis of prostate cancer can occur for these individuals. Prostate massage, useful for diagnosis, presents a risk for bacteremia. The various types of prostatitis can be diagnosed with a segmented culture of the initial stream of urine, the midstream of urine, prostate fluid before and after massage, and post-massage urine specimens. Treatment includes bed rest, analgesia, bladder sedatives, such as a Buno suppository, sitz baths, and stool softeners to prevent straining. Antibiotics may be prescribed according to culture and sensitivity findings in the lab results. Treatment can also include antibiotics, tamsulosin, and fluoroquinolones. All right, cancer of the male reproductive tract. There are a couple different kinds of cancer for the male reproductive tract. The first one we will discuss is penile cancer. This is an incredibly rare form of cancer. It is often caused by the HPV virus or in men who were not circumcised. A non-tender nodule, it usually appears on the penis, and then a biopsy will show squamous cell type carcinomas. Hopefully they can resection the lesion just by laser resection. If not, sometimes a radical resection of the penis may be performed, followed by radiation and chemotherapy. The shaft of the resected penis can respond to the sexual stimulation and enable orgasm and ejaculation. After a total removal of the penis or a penectomy, the patient may still experience orgasm via stimulation of the scrotum and perineal area. Testicular cancer is more common in Caucasian men and occurs generally in men from ages 15 to 40 years of age, and it's the leading cause of cancer death in men from 25 to 35 years of age. Men most at risk for testicular cancer are those who have had an undistended or partially distended testicle. Men who were exposed to DES in utero also may be at a higher risk for testicular cancer. All males between the ages of 15 and 40 years of age should practice testicular self-examinations on a monthly basis. If a mass is found and thought to be malignant, they will perform diagnostic tests such as tumor markers, AFP, beta HCG, and alkaline phosphatase to confirm the diagnosis. Often a CT or an ultrasound would be performed to detect sites of testicular masses. And then it's important to note that this type of cancer does spread very rapidly to the lymph node and the blood vessels. There are 3 stages for classifying testicular cancer. Stage 1 is where the tumor is confined to the affected testes. Stage 2 is where malignant cells have spread to the regional lymph nodes. And then stage 3 is where there is metastases to other organs such as the lungs and liver. If testicular tumor is limited to the scrotal sac and there is no metastases, a laparoscopic surgical removal of the testes, known as an orchiotomy, may be all that is necessary for the patient at that time. Nursing care focuses on teaching and providing the psychological support. We may also provide pain management for these patients as well. And then we have prostate cancer. Carcinoma of the prostate is the second most common cause of cancer deaths among men, second to only lung cancer. Clinical symptoms include a hardened lobe on the prostate itself that's usually found on a digital rectal exam. Treatment includes conservative treatment first, usually involving monitoring and follow-up care. Annual digital rectal examinations are performed, and PSA levels are monitored in high-risk patients. Then when surgical therapy is indicated, a laparoscopic radical prostatectomy is considered the most effective treatment for long-term survival before metastases occur. Other treatment options are found on table 39-4 on page 939. Nursing care for these patients would be to provide emotional support to these patients and their family members. They will oftentimes require pain management, and we need to also educate on post-operative care, such as monitoring for bleeding, avoiding any heavy lifting, and making sure that they return to their follow-up appointment. That would be the end of chapter 39 for today. So I want your end of class activity, please, to answer these questions and then submit your answers to the summary or the submission link on Moodle that I have posted for you all, and then you are done for the day. Thank you all so much for your time, and have a great rest of your afternoon.